Thank you, Dr. Sujit Chatterjee, CEO of LH Hiranandani Hospital, talking to Healthcare Radius. Congratulations on the first PSA oxygen generator at Dr.
Thank
LH
you.
Hiranandani Hospital. Could you share your thoughts on this achievement?
It is the first sort of oxygen generator, which is the PSA, the pressure swing adsorption oxygenator, which we have put. And this was all because of the fact that we were finding that there has been a lot of talk about, especially in other cities, of less oxygen, people being evacuated from one hospital to another for the oxygen, people running from pillar to post. So that was a frightening picture for us. So we had wanted to, get something by where we were self-reliant and did not have to depend on anybody for the use of oxygen. So therefore, when we had got this PSA oxygen generator and we installed it, that from the time the discussion started internally to the time that we commissioned the generator was 40 days. So we are extremely proud of the fact that the whole Hiranandani group came together as one to help us in this initiative to set up the oxygen generator in the most appropriate way that is possible. So I feel extremely proud of the fact that we were able to convince everybody and get a team together who would help us in this venture.
The magnitude of this pandemic crisis has been enormous. We have seen a lot of deaths and a lot of crisis on that. So how has this changed in the way you lead your organization of such a big size?
See, the problem over here is the first thing that you have to do is to ensure that you have your staff on board with you.
Yeah.
See, everybody is frightened, and my crew is young. There are young mothers, young parents, apart from the doctors and consultants who are much older. But you look at the workforce, you have RMOs, you have the postgraduate students, you have your nurses, and you have your front office staff, your technicians, etc. All of them are very young. So you have to give them the level of confidence that, look, we will take care of you. Nothing is going to happen. Don't worry. We will ensure that you are well protected. We will ensure that the best systems are put in place and you all are well protected. Also, there was this time where our hospital occupancy was miserable. So where do you get the money? Does everybody take a haircut? So what we did was we got the entire senior management and the doctors to take the haircut, but none of the young staff was given a haircut. They were all supported. You ensure that the money goes to them. You ensure that my nurses get special food, because they are in PPEs inside the COVID ward for 6 hours at a time. When they come back, they are completely exhausted. But this also, I must say, some of my consultants were completely exhausted. One in particular, who's a pulmonologist, because of the heat, he just passed out. We brought him out. He was given 2 bottles of intravenous infusion and he went straight back into the COVID ward again because he said, I have not finished my round. So this was the type of spirit that we were able to inculcate within the organization. So therefore, we looked after them. We ensured that they were well paid. Despite the fact the consultants and the senior management took haircuts, they said, no question, we'll divert all the money to the youngsters. And at the same time, we ensured that their travel was made okay. So we hired buses. We went to the BEST, that is the Bombay Electrical Suburban Transport. The BEST organization, we went to them, we got buses on hire. The BEST was very kind. They said, yes, we'll give you buses and the driver. So we got buses on hire and we were able to take our staff up and down. So therefore, there was a lot that went into this battle.
That's really nice to hear. So you have put in your efforts, your staff has put in the effort, but there is still a skepticism among what seems to be the significant chunk of population about the vaccine. So, what do you think are the most effective ways that the government and hospitals can encourage them to take vaccinations so that we can fight this virus?
See, as far as vaccination is concerned, one is availability, and the other is convincing the common layperson, etc. Media plays a very big role here. The positive stories needed to be highlighted. The negatives are few and far in between. There are not so many negative stories, even the world over. It has not been so bad. If everybody says that Pfizer was great, not so. The effectiveness of Pfizer vaccine now with data coming in is close to 75%. Covishield is 70%. Covaxin is also 70%. So what great thing has the Pfizer done? Oh, Pfizer, Pfizer, Pfizer. If we get Pfizer, we'll take it. But why not Covishield? So therefore, if we can build up this hype together, we as doctors, you as the media people, you build up this hype together that look, it is good for you. Then in that case, you will get a certain percentage of people coming towards you. The next part of it is that the availability, as and when the vaccine is available, as and when a person wants the vaccine, he should be given the vaccine. So therefore, you have to have more centers. you know there should be liberal distribution. Yes, one thing is very important. What the government is doing is absolutely correct. The portal, if you're not registered in the portal, no way that you should get a vaccination. But if you're registered on the portal, then you should not be given a date and they say, sorry, we don't have the vaccine, come back tomorrow, day after, third day, fourth day. That, if that occurs, people feel that there's something wrong. So therefore, more centers, more decentralization, more advertisement, and the positives. See, people who had Covaxin or Covishield, Covaxin in India have had infection, but the vast majority we've been able to bring around without a problem.
You mentioned about the COVID app where people need to register to get the vaccine. So,
Yep.
what about the
Yeah.
rural areas? How can the government really bring about that change in the rural areas where it is more effect? The pandemic is more effective over there right now.
Yes, the panchayat must be, taken into confidence. It is the panchayat which will be able to help you. Youngsters who are there in the rural areas, they must engage. And when I speak of youngsters, I mean the young doctors who are there in the rural areas. They must engage with the panchayat and the magistrate, the DM, the district magistrate, who's an IS officer, should be the nodal point. He should be the person who's engaging in this discussion, etc., and ensure that this youngster is very well supported by the panchayat, and it can be manual. Every day there can be a manual entry of people who have been vaccinated, and at the end of the day there is a stamping which is done. It is validated by two people that this person, these people have been vaccinated for the day, and the vaccination count is to be checked. If you do this, then in that case it will be very, very good, because if the locals are taken into confidence and the seniors of the village are taken into confidence, if the panchayat supports all this, why should it not work? Why should it not work? If my uncle is telling me, "Arey beta, le vaccination, tere liye acha hai," my sons will listen if I tell them that, okay, you take the vaccination. And they have listened and they have taken the vaccination. It's not that they're not, but they did. So therefore, I'm just taking this whole example down to the rural area. The gram panchayat is so important.
Okay, so what needs to happen to make the system more patient centric?
See, if you feel that people are patients, then people are not patients, they're beneficiaries. Now, if you want to make it beneficiary centric, then in that case, when you I'm now going to give you a very ridiculous example. I'm just trying to drive my point home. When you go to buy a shoe and the particular shoe is what you want, there's only one piece, that is the demo piece is there. And they say that you come back after 5 to 6 days. You may go to another shop and get that shoe, right?
Yeah.
Now, what I'm saying is that if you want it to be beneficiary centric, then first thing first is ensure that you have enough staff arranged to look after these people. So when they come in, the reception should be good. The facilities, seating arrangement, it doesn't have to be 5 star, etc. Seating arrangements neat and clean. The area where the vaccination is being given is neat and clean. The process, one should not be asking the other, now what is the next step, etc. The process should be absolutely well streamlined. They get the injection, they sit in one place, and then they go back. Then the word of mouth spreads. Now people are telling each other, why don't you go to that center? But I went to that center, I had a similar experience. Now people are more, wanting to go. So therefore, if you want to make it patient centric, this is the way, from the infrastructure. Next is availability. So the availability of the vaccine should be there. I personally feel that certain centers should be labeled as, giving Covishield, and certain centers should be labeled as giving Covaxin. Because when I enter a center and I say I want Covaxin, and they say we are out of Covaxin and we only have Covishield, then I have to go back. Now that is a demotivator. But if I know that X center has Covaxin and A center has Covishield, then I won't waste time. I will not be disappointed because everything will be loaded at one particular place.
Yeah.
The third thing is that documentation should be very, very quick. The registration on the CoWIN portal also should be very fast. There should not be times where the CoWIN portal goes down and you have to wait for 1.5 to 2 hours before it comes up again and then try to register. By that time, the center next to your place or closest to you has already been booked. So you don't get a chance there. So I think these are small and simple steps which can be taken just to ensure that we become more patient or beneficiary centric.
So during this period, the technology or the tech in healthcare and future partnerships, one of the effects of the pandemic in so many industries has been the pull that we had been pulled into the future. We have been talking about digitization and digitalization forever, but this pandemic forced us to adapt this digital transformation. So in medicine, more broadly, we have seen that telehealth and teleconsultation and digitization picked up the space. So does LHH have to think differently now? How are you looking forward to the future of medicine?
See, telemedicine is very well established. We have teleconsultations which are going to 200, 250 per day. So
Okay.
that is not such a great this thing. There are people who are taking appointments, and there are various platforms. You have Best Doc, and you have all sorts of platforms which are there, which will help you with all of this. So that's
Hmm.
not what is very great. What is very necessary for us is artificial intelligence. Standardization has to be extremely important. So therefore, standardization of care across the bandwidth of healthcare.
Hmm.
Now, that can only happen if you have artificial intelligence. Now, suppose I just take our conversation away from COVID today. I'm just wanting to take this conversation away from COVID.
Okay.
Let's get into a situation where we have a heart attack. Now, a patient comes to me with heart attack at 2 in the morning. If all the steps are well formulated, that at accident and emergency, this is what happens. This is how the message goes to 10 people who need to come to the hospital. One telephone call, everybody is informed, they all rush. This is how you fire the cath lab. This is how the patient comes in. This is the angioplasty is done and the best result is given to the patient. This is one part. So the second part is the outcome. Now, young patient, no, is a diabetic, is no known smoker. What was the ejection fraction that you achieved? So therefore, if there is standardization of care, then there'll be standardization of results. Now
Okay.
let me draw you back into COVID. Now you have people who, as soon as their doctor diagnoses them as having RT-PCR positive, exhibit steroids. Now, I don't see any logic in all that. So therefore, you have standardization of care.
Okay.
This is what artificial intelligence can build in. That if you have this is your treatment. Now, if you protocolize it, then not everybody will access it. But if it comes through a system where, like Covin app, you have an app which gives you every scenario possible through artificial intelligence,
Mm.
then in that case, you can use your own intelligence and you can come 90% standardization of care. 10% is going to be a variable because we are all human beings. So 90% is standardized. So therefore, in my view, the results will also be standardized. So therefore, you have people who are in the viremic phase, their standardization. There is early immune phase, there is standardization. Then there is the hyperimmune phase, then there is also standardization of care. So therefore, just because you're in the viremic phase doesn't mean I have to exhibit you to steroids. Yeah, if you are entering the immune phase, if you are entering the immune phase and I want to reduce the inflammation in your system, then there is a need for steroid. But from day one, if I give you steroids, your blood sugars are going to go awry.
Yeah.
You're going to pick up some other infection. For
Mm.
example, you may just pick up mucormycosis,
Mm.
and that is the ringing of your bell.
Yeah.
You will have to go to the angels above. So therefore, I think artificial intelligence is extremely important, and India is so rich. You have such fantastic companies. You have Wipro, you have this, that, etc. I'm doing a tie-up with Wipro to our documentation digitized so that we understand the end result. What we are doing is we are working from patients who expired backwards. So therefore, we are trying to see where things could have been, if we had changed the medication or something to that extent. So we are trying to digitize the entire system
Okay.
and ensure that we are associated with Wipro and we're trying to work with them. So artificial intelligence is going to be extremely good. But the telemedicine and telehealth, etc., it's quite a well-established thing in our country. I
Okay.
don't think
So,
there's any.
so, so we are moving towards the digitally smart hospitals now. That's what
Yes,
we mean.
yes, 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 yes. Because look at the volume.
Hmm.
The volume is enormous. Here you require standardization. Here you can't say that, okay, it is a one-off, let's put antipyretics, and he'll settle down, don't worry. It
Hmm.
doesn't work like that. It
Yeah.
doesn't work like that. So you have to have rigid protocols in place. And the only way that you can define the result of a protocol is if you have, you can't put it on paper and start making a spreadsheet and doing it. This has to
Hmm.
come automatically.
Yeah. That's true. Okay, Doctor, one thing that I have not put in the questionnaire is I just happened to read it in Nature that, mixing the doses of the vaccine is more effective now, apparently. What's your take on that?
I see. We are too early in this disease. Vaccines generally come after many years of research and thing. Here we are off the fly. We've got vaccines and everything included. So I don't think it's a good idea to do a mix and match at this particular time because there is no real sort of certified, validated data which is available. This is, it's like, this broth tastes good, so use it, it's fantastic. So it's like that. I wouldn't go for such a thing. If you've taken Covishield, it's good. And now the mutant strain and all these things. See, viruses are known to mutate, and the viruses will mutate. So therefore, just because you mix vaccines and you'll get better immunity, very, very nascent, very early days. I don't think anyone should really look at it very seriously. If you've taken Covishield, carry on with Covishield. And if you've taken Covaxin, have full faith in Covaxin. Go ahead. Vaccines are good. There is no doubt about it.
If anything that 2020 has taught us is the futility of forecasting. So, how would you personally approach forecasting in an environment like this? What are you looking forward in the next 5 years?
For there would be a short time, goal, and there's going to be a medium term, and there's going to be a long term. In the short term, I would be looking very closely at epidemiologists, what they predict for the third wave.
Okay.
You know, if there is this thing, and I would be and we are looking at literature, we are talking to epidemiologists, we have epidemiologists on board in this hospital, and we are asking them to find out through various studies and etc., will there be a third wave or not. There is no clear cut answer, but it seems there could be a possibility of a third wave somewhere around, say, end of August, early September. It
Okay.
might start. God forbid that happens. So therefore, that would be the short time thing that I'm looking at. In the medium term, what I see is that complications of COVID coming up, whether it be people who have breathing difficulties, whether they develop diabetes because of whatever apparent reason, or there are some other effects that take place. But in the long term, what really frightens me is the effect of this time on the mind of the person. So
Mental
that is
health.
what really frightens me. Mental health is what really frightens me because there are youngsters. Some of them are 35, 40 years old. They've got so much to go ahead, but they have been isolated. They have
Hmm.
been cut away from their families. So some of them were not sure whether their salaries would be credited. Some of their family members they known have died. Imagine their mental state. It's not going to come today, it's not going to come tomorrow, but in the long term, definitely we have a major problem cropping up. And I feel we as a tribe have to address it. I also feel that the government should be very alive to this and should really do some intense brainstorming with the best brains in India to find out how they can actually reduce this impact on the mental health. We are a young nation,
Hmm.
and it is the youngsters who've had a bit of a hit in the second wave.
Yeah.
Now, if a young nation has to develop, then everybody has to be healthy in mind, body, and spirit.
Hmm.
So, therefore, a young nation has to be healthy in mind, body, and spirit. Now, you may make him healthy in his body. You may improve his spirit by saying that, look, economy is looking up, everything is looking up. Don't worry about your job. He gets his job back. But did you think about his mind, or you just left it alone? And if you left his mind alone, then all these experiences that he has come are going to come to haunt him at some time, or her at some time. And I think that is the most frightening. So, therefore, we have a short term, we have a medium term, and we have a long term. The short term is whether you're going to have another problem. The medium term is that ensure that complications settle down. But the long term, I have not even been able to think it.
I
I'm
am
being very
worried
candid.
about the children who have lost both the parents. How are they going to cope up? Their mental health needs to be looked at, and their well-being. That's one of the things which are looking very squarely at our face, and hopefully we will be able to
Yeah.
come. Last question: if this is one pandemic, and we were taken by surprise, are we prepared for another pandemic? Not COVID, but if there are some other pandemic, are we prepared for it?
See, preparation in a huge country like ours, with a population like ours, is not so easy. Learnings are there. We will be able to react fast.
Hmm.
But if you're talking about preparation being infrastructure, but if you say, are you prepared? For me, preparation is a very, very big thing. I have to have my staff, I have to have the number of beds, I have to have the infrastructure ready, all these sort of things. Were we prepared for oxygen? No, you had a hell of a bloody time with oxygen, no?
Yeah.
So the whole country nearly shook. But ultimately we got ourselves together and we have come up with solutions. I mean, there were so many solutions. People had those in Delhi. There was oxygen langars and
Hmm.
all these sort of these things which were created. Though innovative ideas, etc. People have, and
Yeah.
we
Yeah.
Indians are very good at that. But you asked a very pertinent question: are you ready? I said, no, we're far from ready, but we can react fast. We will react very fast. But readiness is the entire gamut. So therefore, the government of India, in their infinite wisdom, must think of 3.5 to 4% spend on GDP in the next budget and prepare. Your question is very pertinent. Your question, are you ready? Is that you're very pertinent. So therefore, if the government has a huge spending on healthcare, let me bring this point back again, that we are a young nation. So we have the world's biggest opportunity to become a dynamic nation, not only economically but also health point. So
Hmm.
therefore, there has to be a spend. If you spend and you make all these things ready, then in that case, why should we not be ready? We will be ready. But
Okay.
it requires a big vision, that
Yeah.
here's my country and this is what I have to do. So that vision has to be extraordinarily good. And I think the spend of anything less than 4% of GDP would not be right in my eyes. In my eyes, this is my personal opinion.
Hmm.
In my eyes, it would not be right.
Thank you, doctor. Thank you for your time, and thank you for sharing your thoughts and your opinions.